All right, Dr. Billy DeMoss here from DeMoss Chiropractic with a great friend of mine, Dr. Claire O'Neill, chiropractor and also registered thermologist. Dr. Claire is who we do our thermograms with. We're going to go over a discussion today on breast health and the 5 reasons you would choose thermography over mammography. Welcome to the show, Dr. Claire.
Thank you, Dr. Billy. Good to see you again.
It's good to be seen, as I say. Number one, there's 5 reasons why you would pick thermography over mammography. Number one, it's non-invasive. It does not cause cancer. I've heard you say this many times, that mammograms, one mammogram is the equivalent of 500 chest x-rays. You're getting radiation. And in my opinion, my humble opinion, that mammograms probably cause more cancer than they detect. And we've seen the medical profession kind of sidestep and backtrack with what they recommend as far as annual mammograms and also the age that we should start doing them. Correct, Dr. Claire?
So, yes. So basically, I do want to kind of make it a little bit more specific. It's actually one mammogram series because, again, they're doing mammograms, they're doing them on both breasts and they're smashing, right, both sides. So they're actually 2 quote unquote pictures per breast. And that series is where you get such a massive amounts of radiation. And we have to remember radiation accumulates. So it accumulates with every mammogram you get.
All right.
So I concur that it is my humble opinion with yours that mammograms cause more cancer than they detect. And just like everything in medicine, they're not going to do that type of research because they don't want to know the answers.
Right. The number 2 reason would be that it's non-painful. Thermograms are non-painful compared to mammograms, and you'll elaborate on that. As far as the other detrimental side effects of the 62 pounds of pressure that they apply to the breast.
Smashing. Yes. The great thing about infrared thermography is it's just a camera and it is away from you. Nobody's touching you. So there is no compression. There is no smashing of the breast. There is no radiation. There is nobody actually even seeing you except through the camera itself. So it's 100% non-invasive.
Okay, we also talked about that 62 pounds of pressure on the breast can cause significant pressure to the point where if there was a tumor, we could see metastasis with that tumor, correct?
Yes, and also when you're smashing the breast with that type of pressure, if you have a tumor that's cancerous, right, it can burst it. And as you already know, there are often tumors. So breast cancer is a 15-year disease, and it actually will be growing for 15 years. And the average mammogram or ultrasound will see it around year 7. It has to be around a centimeter in size, which by that time, usually the body's already is encapsulating a tumor. And that was something that we call DCS, situ, meaning it's encapsulated. Okay.
Another issue would be the fact that if you had breast implants, that could cause some issues as well.
100%. So when you're looking at, again, looking at that compression, sometimes they actually have to pull some of the tissue away from that implant to be able to see what they're trying to see with that quote unquote. It's, the mammogram it's an x-ray, strong x-ray. So when they're doing that, also the balloon of that implant often will get ruptured. And then of course that contents are coming out. And then the side effect of that also could be cancer. So to rupture and also pulling that tissue away from that implant, and that's scar tissue, because again, you put a foreign object in the body. The body's response is inflammation. On top of that is going to be scarred tissue. So it's kind of very injurious to that breast tissue.
All right, the number 3 reason why you would select thermography over mammography is the fact that thermography will pick up the cancer 8 years before a mammogram, well, as you said, the size of the tumor, you said it was a centimeter before you'll see it on a mammogram, and that you said that was 8 years, or how long does it usually
Yeah,
take?
that's normally 7 to 8 years into the disease process. So when looking at a mammogram, even a self breast exam, ultrasounds, MRIs, those are what we call anatomical. In other words, structural. You have to have the tumor in there. And the tumor, as you know, starts as a little cell that just keeps replicating to the point that it gets big enough that they can be seen. The totally amazing thing about infrared thermography is I'm actually looking at the physiology of it. So we can actually watch the beginnings of an abnormality in that breast tissue before it forms into that cancer state. And often it's done with, I mean, there are some ophthalmologists that all they do is take one series of scans, and they're basically looking at scans or pictures of your breast, and they're looking for, we use the term heat signatures, so thermal patterns, and they can see some vascular patterns. What I my approach is a lot more specific because I do what's called the breast stress study system. So my goal is to also see changes in those thermal patterns, changes in the vascular patterns, and I'm very specific about temperatures. So I want to see changes in temperatures. So the way to look at physiology on breast health, you first take your first set of scans. Then you put your hands in cool water for about 60 seconds. What happens is the body has its own blood supply, right? And then normally when we cool down, blood will leave our extremities and will go to our organs to keep our organs warm. But what will happen then is if you have cancer growing inside your breast, right, before it even turns into the tumor, right, that blood supply, the body will create, the cancer will create its own blood supply through a process called angiogenesis. That blood supply is not part of the innate intelligence. So that blood won't go to the organs. It will stay to feed the tumors, to get that tumor to grow. So that's why I'm looking for changes in temperatures, changes in those thermal patterns, and changes in the vascular patterns, so I can see the physiology before it becomes a tumorous state.
Number 4 would be the fact that thermography doesn't have the amount of false negatives that we would see with mammograms, because we've got 2 types of, well, a lot of the tumors are in the axillary part of, or you called it outer
quadrant. Yes, very good.
in the axillary area. You're not going to see that on a mammogram, so you're not going to, you wouldn't detect that cancer. That's going to give us a false negative. The other issue would be with inflammatory breast disease. That's going to be more, you're not going to see really any tumors because there's no tumors there. So those would be the 2 areas where we're going to have false negatives. Do you want to elaborate on that a little bit?
Very much so. So basically, when we're looking at mammograms, ultrasounds, those types of things, they're looking at what we call the fleshy part of the breast. Now, the upper outer quadrant, you have to have breast to the collarbone of the clavicle. And then, of course, it's going into the axilla. So that breast tissue is a larger spot or expanse versus than just the fleshy part. So most of the tumors, 70% are found in that upper outer quadrant, which the mammogram can't see. So the mammogram's only getting 30%. That's a big chunk. Right. The other thing that I always call the hypocrisy of mammograms, because they call it the gold standard, is one of the most aggressive and fast-growing tumors. I should say tumors, breast cancer is called, as you said, IBC, inflammatory breast cancer. There is no tumor in that breast cancer. That is just a massive inflammation happening through the whole breast. And so that cancer spreads very fast, and there's no tumor. So if there's no tumor, you will not find it on a self breast exam. You will not find it on a mammogram. You will not find it on an ultrasound, and you will not find it on MRIs, which are the medical mindsets for diagnosing of cancers. So you're right. A lot of cancers are missed because the medical instruments, what I call the medical money machine, it's just hypocrisy. Let me just put it that way.
All right, let's hit number 5 here. Obviously, if we see something that is suspicious or we can consider to be, and you can rate the stages where they're at, correct? When we have a whole a process where you rate those. Why don't you go ahead into the staging of the breast cancer?
So basically, medicine stages it differently than I do. Medicine will have stage 0, which means it's not cancerous. That would be a DCIS, the average, any IS, which means in situ, which means the body is encapsulating those bad cells to starve those cells from any blood so they cannot proliferate or multiply. So then they go into stage 1, stage 2, stage 3, stage 4, also associated with the amount of metastasis or growth and movement of that cancer. Now, for breast health, I actually have, again, stage, we call it TH1 to a TH5. TH1 is 100% normal. TH2 is also within normal limits, but we'll find things that I can find on a thermography is I can find hormone imbalances. And we do know that 93% of a hormone imbalance is too much estrogen, which is one of the leading causes of breast cancer. I can also discern tumors that you have as being, if they're cystic, fibrocystic, calcifications, dense breast tissue, fibroadenomas, etc. So those are what we call benign tumors, benign conditions, but they can morph into breast cancer also. And then we'll move into what's called a TH3. TH3 is where we start to get into what we call equivocal. It's abnormal, and depending on those numbers, it lets me know what we're watching on those. And you go into TH4 and TH5. And again, I want to say grade, because I actually, each thing I see has a numerical component to that, so that I'm actually grading your breast health. And then I could say, okay, you're a TH3, we have some things that we want to work on. And then again, I'm actually showing the physiology before it moves into that tumorous state.
All right, just real quick, what does the TH stand for?
You know what? It is, you had multiple doctors back in the 50s and 60s, one being my mentor, which was Dr. Chapman, and a doctor in Europe, etc. And they came together and they formed the term for the TH and the grading. And it was actually putting terms together. The two names would not make sense to the average person. Still doesn't make sense to me, though I love Dr. Chapman dearly.
All right, so we're not worried about them. Okay, we've got 3 minutes left exactly. Number 1, so with the frequent testing, and if we see something that's suspicious or we have issues, then we're going to be really proactive about number 1, our nutrition. We recommend nutrition from Standard Process. We'd also want to minimize any xenoestrogens, which are chemicals that mimic estrogen, which are going to accentuate the progression of the cancer. We're going to limit sugar. We're going to probably do hyperbaric. We could do any type of cannabis or CBD work.
And your femurs.
We could do mushrooms. Obviously, we would put chiropractic in there to upregulate immune function.
And I'm going to say that's your number 1.
Right. And then also we could, I don't know if I said Beamer, which is going to PE, pulse electromagnetic frequency, which helps not only feed the breast, especially if we're doing hyperbaric oxygen. So there's so many things we can do proactively, and then we can consistently monitor a patient with thermography without any, concern about cumulative radiation exposure through a mammogram. Let me get this out before we end this call real quick. We are doing thermography here at DeMoss Chiropractic in Newport Beach. And what days do we do those in our office? Do you know?
They're on the first Saturdays and the third Tuesdays at DeMoss Chiropractic. And we want to expand if you're open for it. The more busy we get, the more days we'll open.
And we want to do that as well. We want to get this information out to our community because women have been really a target. And I think that the medical profession preys on women to some degree. I mean, I know guys aren't going into the doctors as often. I think women are more the nurturers in the family, and they have more faith probably in medicine than men do. And again, maybe I'm being overly generalistic here. I don't know, but what's your opinion on that? We got a minute left. So if you want to have thermography done, you can call our office at 949-250-0600, right off the 73 freeway at Birch. We would love to have you down to our office. We can check and have more health.
And don't forget the talks. Well, I'll be down doing the ABCs to avoid breast cancer on a quarterly basis, usually on a Tuesday night at your office. Please, check in with Dr. DeMoss because you'll be able to meet me face to face in those talks to answer any additional questions.